This program was made possible by grants from the John and Diane Laxmi Family Charitable Fund, the Azfar and Maheen Malik Family Foundation, and the Missouri Asian American Youth Foundation.
I don't know if I'm doing this to cope or if I'm doing this because my friend told me it feels good.
Hi, I'm Aisha Salton, and these are things we don't talk about. Nikki is a 12-year-old middle school student. She started using a small file to make little cuts in her arms and legs. She started self-harming a year ago as a way to cope with overwhelming feelings of sadness, anxiety, and frustration. Sometimes she feels numb, and cutting gives her a sensation of relief. She feels intense academic pressure and doesn't feel like her friends are real friends. Despite being a bright and talented student, Nikki struggles with low self-esteem and perfectionism. She hides her injuries under long sleeves, feeling ashamed and afraid of being judged by peers and her family. She also pulls her hair out. I'm joined by psychiatrist Dr. Rafia Malik and school counselor Dr. Noor El-Hayati, who both have worked extensively with self-harm patients. They're going to help us understand better what Nikki is going through in this hypothetical situation. Thank you, ladies, for joining me today.
You're very welcome.
Can you tell me a little bit about what compels a person to hurt themselves?
Yeah, I mean, this is a very important topic, and thank you for having me here for it. Especially with the age that Nikki is 12-year-old, a young adolescent, it is not being able to identify healthy coping mechanisms to deal with stressors in life. So it is, there are many compellers. One, that this is a sensation that they somewhat sense a relief when they do self-harm, but also in the world we live in today, we cannot undermine peer pressure. So there is exposure to social media. There are friends either in person or on social media who are talking about different ways to cope with feelings, with sadness, and this is one that is becoming a little more popular with that.
Wait a minute, so there's actually social media people who are advocating or showing people that you can do this, you should do this?
Typically, it is within their age group that it feels good to do this. Typically, it is access to social media within that similar age group is what we're seeing. So it is almost like trying it out as what we're seeing other people are doing, whether on social media or in real life.
Dr. Malik, how young can self-harm really start?
So, Aisha, it can start as young as 12, and maybe even younger.
Where do you see, in your practice, in your experience, people actually coming in for help? What does that look like?
Because I don't see children.
Right.
So, but I tend to see them a little bit later. But what I think what it does is, it goes, these are the people, self-harm sometimes can just be very, very like fleeting, and then it stops. But then it sometimes is progressively worse.
And what happens when it gets worse?
So when it gets worse, what happens is there are medical consequences. These are people who self-harm. They're also become so worse that they can become more suicidal risk. So if the continued self-injury continues, then these people can actually do harm to themselves and hurt themselves, and can even have a suicide attempt deliberately. Because what happens is that as they continue to hurt, they're isolated, they're hiding from people, their relationships are not right, and the underlying things that led them to this, their coping skills are not healthy, and they're doing this, and medically they can be scarred. So there are a lot of consequences, and a lot of time it also leads to eating disorder. I don't know if that's something you have seen.
I wanted to also just, before it does, we've seen connections with self-harm and eating disorders, and even like just a connection with that and self-image. Just going back a little bit as to when they come to seek help is, a lot of times we see that connected with awareness from, especially if we're talking about a 12-year-old, awareness from the adults in their life, their parents. And so we see people seeking help at the very first stage if there is that awareness. Then we see people seeking help at a very much later stage.
That's like probably where, that's probably where I see them. And like I said, they have had treatment, but sometimes it's not successful.
Right.
Because there's so many prongs to treatment
Right,
that I
right.
think, so you catch them at early, and then if it's progressively, then that's where I had to work with them.
Noor, when a 12-year-old is brought to your office, a lot of times it might be a parent, like you said, are they reluctant to talk about this? And how do you get them to open up and figure out what's going on?
Absolutely. So I can speak from two perspectives. School, we follow a protocol. So in schools, we follow a protocol to ensure the child's safety, connect the child to resources, and make sure the child has the help they need immediately. From more of a clinical setting, which I do get, like even younger children, I work on first building the connection and establishing a relationship with that student that is based on trust, with the client that is based on trust that they can speak about those issues, because that is extremely important to allow clients to actually go to these directions that they don't typically speak about. So that is my focus at the beginning.
In different communities, how do you see this manifesting? And what are some of the challenges in different communities that you've served?
Yeah, so culture plays a very, very, very important factor in how people approach mental health, right? So, for example, I work with the majority of the population here in the United States. I also work with minority populations. So I've had clients who come from faith-based backgrounds that associate self-harm with weakness of faith, which connects to guilt and then causes a bigger problem. So there is more hesitation to seek mental health when it comes to any mental health issue that is associated with added guilt due to this not being something talked about in my cultural background or with my family or so. So culture does play a factor, and I've seen it cause hesitation to seek help with.
Dr. Malik, how do you see culture playing a role?
So I said denial in these kinds of things is very big, especially in the family and with the parents. So I think because I see more older population, so like I said, I think Noor has more experience with that. But I also wanted to just bring something up, that there are some mental health disorders that are directly connected to where self-injury is a lot more. And like borderline personality disorder is one, autistic disorder, autism. These people, they self-harm themselves also because that's a coping mechanism for them. They're unaware of that, but it's present there. Bipolar disorder also has, so I think these disorders are in every culture and every community. So, but the stigmatization, people hide this thing, there is more shame associated with it, and there is reluctance to even come to help even at later ages unless some event happens with them. Aisha, some of these women I have seen coming, again, abuse and trauma is a big one. And they come to seek help when their own child gets to that age. I saw it so much that I made that connection, that they don't want to be repeated, and they come to get help for themselves. And they have been doing this for so long and hiding it.
Oh, that just gave me chills to just imagine that you've been suffering or hiding something for that long. And then when your child gets to that age, you think, I have to fix this because I don't want my child to go through the same thing.
That's exactly.
That's so interesting. Noor, I have a question. I come from a Muslim background myself, where religiously we're forbidden to use substances like alcohol or drugs. Now, can cutting or harming yourself create a similar sensation to where people might find like, oh, at least I'm not drinking, at least I'm not using drugs, I'm just making a mark on myself or hurting myself?
Right. So yeah, absolutely. When we look at coping, what most majority of people, I guess, use to cope, we can classify addiction to alcohol or even starting to use as either alcohol or drugs with the Muslim community specifically be something that there might be a little more hesitation to resort to if the person who's struggling is trying to stay away from things that are prohibited Islamically,
Okay.
which does open up a wider door to self-harm, right? So that is a very good point that you bring. So these are, all of them are identified as unhealthy coping mechanisms, but it is, with the clients I served, it is easier for them to resort to self-harm or even speak about it, at least with the clinician, than if they did go the direction of substance abuse. But that still exists widely within.
Oh, of course, in all
so
communities.
just to acknowledge that too.
What kind of reaction do you get from parents when you tell them that your child is engaged in this behavior?
So denial is one.
absolutely.
So,
Like, what type of responses do they give you?
for example, it's like, no, they're not doing that to themselves. This must be accidental. This must be. This is not real. This is not. And even if we establish that they're taking this action and coping in this way, I hesitate to not have a much deeper, long conversation with parents about it, because the first inclination is to sit with their children and just immediately put a stop to it as if it's like a magic wand that
So,
causes it.
Dr. Malik, what if you just go to your child or your spouse or a loved one and just say, just stop doing this? Why does that not work?
So it's the same thing. We just talked about addiction. So if you just go to someone and say, stop doing this, right? They are not going to be able to, because until and unless, Aisha, the underlying all those reasons that they started doing, right? So the stress, a loss, a grief, again, a recent trauma. Maybe there was some trauma before, but a recent trauma re-triggered that. So I think you really have to see it as a process of recovery and deal with all the underlying things that are going on. And I think for children also, young girls, the stress at home, parents' relationships are also something that, that one other thing that I wanted to, if I can add to that, the same thing between, so when they self-injure, the substance that is released is opiates.
In your body.
Your own system releases it, and that gives you, again, that gives you comfort, release anxiety, and lifts your moods up. It's very temporary, Aisha. Then what happens is, the reason they do it again and again is that it really gives them that very little time to where they disconnect. It's almost like they dissociate. They're not even there. They can escape all the bad things that are going. And the medication that is used specifically for helping self-injury is an opiate blocker,
Oh,
which is the same medication that's one of the medications that's also used to help people stop drinking. Because the mechanism in both the cases is to stop, so when they take that medicine every day, when they self-injure, they don't feel anything because you blocked their internal opiate system.
And if I can add to the reasons that are, like, besides the fact that it does give them that feeling,
Yes.
it also allows them to feel that they're in control.
Absolutely.
So it's usually there's a deeper pain that is unseen, and they are not aware of it. Yet a physical injury is pain, is some kind of a pain that they're in control of, that they see, and it does distract them in a way from something that they are not able to control to something that they can control.
Interesting.
Yeah.
And do you find that it helps to be able to explain that to people, to help them understand this is why you're doing this?
Absolutely, absolutely. So like I said, we focus first on that connection, and then we go to talking deeper about it. So if we're able to explain that, if we are understanding what are the changes in your life, what are the stressors in your life, and talk about it, bring it out to light more, and you're able to see that kind of pain, whatever's causing the pain, then we can work on that rather than resorting to a coping mechanism that's causing pain that you can see. Let's work on seeing your pain, working on that, and moving forward from there.
And I think, if I can add, I think that is also when the girls that start very early, the hormonal changes are also happening with them. And even with mental health disorders, the girls and boys are at the same, almost the same equal depression and anxiety until the girls hit the periods. And then the doubles up depression. So I think the hormonal changes also.
What doubles?
So the incidence of depression doubles in women versus men when the girls start to, when they start to have hormonal changes happens, the period starts. Wow. So in women disorders, like I think there is a big connection to the hormonal changes that happen with the onset of age, like 12 to 14.
Right.
Noor, how do you address embarrassment and shame in situations like this?
Having more conversations about it. Having more conversations. Like, I can think of your question as a one-on-one basis, and I can think about it as a community basis, right? One-on-one, both ways, having more conversations about it, normalizing that this does happen, this does take place, so that when individuals are resorting to self-harm as coping mechanisms, they're aware that they're not alone in this. So that does cause less shame, less embarrassment. Having more community talks about it, conversations, and awareness, knowledge.
Dr. Malik, I think there are some people who think my child would never do something like this because we come from a good family. We come from a loving family. Can you speak a little bit about the types of families that this kind of behavior can cut across?
I think, Asha, from what I have seen, I think the families that don't openly communicate, there is a big emphasis on pretenses, how you look more than how you feel, and keeping your kind of your image is so important. So these kinds of discussions are not happening at home. A lot of time, they will also say that their parents are not emotionally available to them. So these are not. So I think this is the thing that maybe in a preventive way, as in the community or in the media, it can be taken as something that, it's important for kids to be able to have open discussion about stress, how they cope, how the drugs are used. So I think this has to be, the communities need to be involved, the families need to be involved. So there's a whole lot of work that can be done to prevent it.
Right, and that's something that is very important to highlight. If we focus more on the preventative approaches, then we are ready for the responsive.
Absolutely.
Right? So it is much harder for parents to give the support needed to their child if they reach a stage where they are coping in unhealthy ways or so. If the preventative measures were not put in place. Preventative measures does not prevent completely the problem from happening. It really prepares you, if anything happens, to respond in a way where your child is with you there. Like you said, more conversation about feelings, because these are all coping.
Absolutely.
Like coping to deep stressors and sadness and things like that. So if there's more conversation about that at home, and even it can start with a basic question instead of like, how was your day at school? Just like going, okay, tell me more. What was the best part of your day? What was the hardest part of your day? How'd that make you feel? Like those kind of conversations that allows children at home to speak about their feelings, and therefore, when things like this happens, the response would be the conversation around it, and the response would be easier.
Noor, what does the path to healing look like in a situation like this?
So if it's really a case by case. If I'm just like taking your question and thinking of it as somebody who is coming to me with the same issue, Nikki's, yes. So as a counselor, I work from a CBT approach, cognitive behavior therapy. So I would, again, first work on establishing a relationship and a connection that allows Nikki to trust my work with her and me as a counselor. And then oftentimes a lot of what we do behavior-wise, action-wise, are connected to our thoughts, cognitions. And if our thoughts are irrational, it can cause these behaviors. So I go back to, what are we telling ourselves? What are you telling yourselves? And we work on replacing irrational thoughts with rational ones. And therefore, it becomes easier to also work on replacing unhealthy coping mechanisms to healthy ones.
So one thing I either read in a book or a very smart therapist told me is that you can change the way you feel about a situation if you change the way you think about it. Does that resonate with you guys?
Yes and no.
Okay, say
So
more.
Yeah, yes and no. So I think what happens is that cognitions can be very, very distorted,
Okay.
but the emotions are real,
Yeah.
right? So what you're feeling is, and you feel all extent of like happy, sad, anger. So, but when they're emotions, these are normal emotions, right? But when there is emotional dysregulation that you see, Asha, that has to do with something that is causing that. Whether there is, again, a crisis, a trauma. I keep going back to depression, anxiety. So underlying things that are there also. So I think it's a simple question, but I don't think I have a simple answer for that. I think all of us can benefit from therapy because we all have some negative coping skills.
Right.
So I will let you see if you have a more clear answer.
Coming from a CBT therapist perspective, I do connect our feelings a lot to our thoughts. However, it's not like one way leads to the other.
Okay.
It's almost like, if you want to imagine it, a two-way arrow, where it could be the way I'm feeling right now is making me think something which is causing this behavior.
Okay.
Or what I'm doing right now, especially we see this with impulsivity. The actions I'm taking right now is causing certain feelings, which is causing me to tell myself things like I'm not good enough, or so it's almost like a two-way street, either direction. But
Yes.
I from my work and my perspective, I see that it's very highly connected, feelings with thoughts and our behavior and actions.
Interesting. Now, what do you think are things that we don't talk about enough when it comes to self-harm behaviors?
We don't talk about that it is a real thing, that it is a coping mechanism, that an unhealthy one that oftentimes children and specifically adolescents are engaging in, and that it is happening a lot more than we think it is. Again, I've worked in several schools, so just like, and then also that there is communications between our children at this age that is encouraging at times these behaviors. I did have clients before who told me, I don't know if I'm doing this to cope or if I'm doing this because my friend told me it feels good.
Wow.
Yeah. And then another thing is the effect and impact of social media. I know we were having a conversation about that. Like just how many years ago, like if we just take 10 years ago, and this is especially for a certain generation that was not as exposed to this social media world, has to understand, it's not talked about enough, is that we were aware of how many friends we had. Like we can count how many friends you have. These days, like when I ask my own children or students about friends, they tell me like, oh wait, do you mean how many friends I have on Discord, how many friends I have on Snapchat, how many? So we went from having the 3-4 close friends to talking about, no, I have 300, I have 400 as friends, as followers. So the exposure level is beyond what we really experienced ourselves.
That's a great point. And something as raising kids with social media, not having grown up with social media, it's something that I struggle with to understand, to keep up with, to relate to. Dr. Malik, what are things that you think we don't talk about when it comes to self-harm?
The earlier it starts, the earlier interventions it happens, I think the earlier it is to stop. If it is just, if it's led to just kind of progressively get worse, the consequences are going to be just more. And I worry about the safety. Sometimes it's an unintended harm. They can do, by mistake, they're just going to, in order to get that high, they can cut deeper and can, and can have a lot more harm. Another thing I just wanted to talk about, there was a time then, when I was working with that program, that piercing. So, these young people were getting all kinds of piercing everywhere. And the thought was that is also one way of a self-injury because it just, it gives them that kind of. So I think that's really, really important to be able to look at the trajectory and that, social influencer. the kids. And I also think that there should be some treatments with group therapy approach.
Right.
Because I think the kids, friends are important, their own age is important. So they sometimes think we don't even understand the language that they're speaking.
Right. And sometimes we don't understand the language that they're speaking.
Right, right.
Yeah.
But the treatment program that I had worked with, I saw the real impact of the group therapy in that. But that was a residential program in which all CBT was one therapy that was provided. Dialectical behavior therapy was also provided. That was also, and I think, again, trauma is behind a lot of that. And that needs to be addressed in therapy, and that's even harder to talk about.
Right.
So, and the family involvement.
Right.
So if you cannot treat, 13, 14-year-old without really educating the family, teaching them coping skills and how to have communications with each other and talk about feelings. I think those things help, so they don't have to keep it inwards.
Right.
And they have some safe adults to come and talk to.
I had no idea that there were social media influencers or in those age groups that encourage this or suggest that it could make you feel good. And so that was very new to me. And a lot of the information I learned was really eye-opening. And thank you guys for coming and sharing it. Thank you so much for listening to the things that we don't talk about.
There might be a little more hesitation to resort to if the person who's struggling is trying to stay away from things that are prohibited Islamically,
Okay.
which does open up a wider door to self-harm, right?